The third trimester is often when the fear-mongering ramps up. Diagnoses, interventions, all the focus on everything that could go wrong, and the what ifs. But what if instead of that, you could focus on a low intervention third trimester and birth so that you can focus on a healthy physiological birth and a smooth postpartum recovery? That's exactly what we're talking about in this video. Hello lovely, my name is Inge Sprey and I'm a fertility homeopath. I help couples worldwide to fall pregnant naturally with the resources on this YouTube channel, as well as my DIY and life programs. And welcome to video number 3 on a low intervention third trimester and birth. It is part 3 of my low intervention pregnancy series. So if you haven't seen the previous 2 videos yet, I'll make sure to link them in so you can watch those as well. In this video, like in the previous 2, I am going to be sharing tons of resources for you to look into after watching this video to help you with your low intervention pregnancy and birth and postpartum period. And you can download that guide. The link will be somewhere underneath this video. The pregnancy guide is a great start, but if you're looking for some in-depth support on informed decisions around interventions, as well as your alternatives, some exercises for turning baby if necessary, and especially homeopathic remedies, then I refer you to Growing Bump. This is made exactly for you, and I think you will love it. As with the previous 2 videos, I will start sharing what I did to keep my third trimester low intervention, and then what I recommend to my patients in addition. So what was really important to me in the third trimester so far is the spinning babies exercises. I talk about it in the second trimester video that I started then, that it's all about alignment of your body so that there is enough space for your baby to grow and for you to build stamina for the birth, but also for pelvic alignment, and so that baby can turn timely. Now, this baby was going up and down on transfers for quite a long time, but I figured it had to do with the fact that it's my third pregnancy. But I'm at 37 weeks almost now, and baby is nicely head down. I don't think engaged yet. Are you engaged? Are you? But that can even happen in birth. However, I am continuing these exercises because they will facilitate that as much as possible. If baby wouldn't have turned timely, there would have also been homeopathic remedies that I can use, and I share those also in Growing Bump. Finally, into my third trimester, the nausea has improved. At 35 weeks or so. I didn't expect it to go away at all. So I'm really thankful that it did, because right now I'm really trying to restore my nourishing traditions way of eating to prepare myself for the recovery after the birth, as well as a milk supply. So that is my focus right now. In contrast to the second trimester, I haven't done any nutrient tests. There was no need for it. I was offered the HB test just to see if I may need some iron supplementation if I have a lot of bleeding during birth later on. But I figured I'm supplementing myself with Floridix at the moment, and I will also do that after birth to support my iron levels. So I didn't feel there was a point to do the test. And if I feel anemic postpartum, we can always do the test then. And as I encounter any kind of discomforts, I continue using my homeopathic remedy kits, depending on what's going on. But I've also changed my base note remedies, so to speak. They're more focused now on preparing the uterus for birth to make sure that the contractions are going to be nice and regular and smooth, and that the uterus is prepared. And I do share these remedy suggestions with my patients always leading up to the birth, starting at week 36. And I will also put those in Growing Bump because they make a huge difference, together with the spinning babies exercises and preparing mentally for birth. Being able to prepare your uterus for the work it's going to be doing, it's going to set you up for a smoother birth as well as a smoother recovery, which is better for baby too, right? You may have come across some other things as well to support a smoother labor, such as red raspberry leaf tea. Now, I don't like it at all, so I haven't been doing that. But now that I'm 37 weeks, I'm probably going to start incorporating it and find a way to like it. But other than that, the dates are often recommended, and I think those are some of the grossest things that exist, so you will not see me eat any dates. What I do use is primrose oil. At the moment, it's still, while the capsules are still orally, but when you're at term, you can also use them internally, so vaginally, to help soften the cervix. However, it's good to keep in mind that there is some discussion about the use of primrose oil, especially vaginally, and prematurely ruptured membranes. I did have that with Lily Rose as well, and I don't know if that has to do with the primrose oil, although I doubt it, because I also used it with Noah and it wasn't the case, and it can still happen. But it is good to do that with caution and not just randomly be like, oh, I read that somewhere and let's just incorporate it. But it can definitely be helpful to help efface and soften the cervix much faster, which shortens your labor time, which is what we want. There are two other things that I wanted to mention that I have tried in the past, and one is the Epino, which is a device to help train your pelvic muscles and stretch things. I didn't like it. I didn't find it helpful. And the midwife that I had before this one also said that she wasn't a fan of it. So you can look into it if you're worried about birth, if you're worried about tearing, then it doesn't really matter what you do. Anything that you do that, even if it's placebo, even if it doesn't make a difference, it will make a difference for you mentally. But if it's just another chore on your list and a must do, then skip it. And the same applies to perineal massages. While I do think that applying vitamin E or calendula oil or something like that is of course supportive of the tissue, but honestly this time around I haven't paid that much attention to it. Of course, a really important thing to do in my third trimester was to finalize my birth plan. This was quite easy for me to do because I have done it twice before as well. But I have now a midwife group because we moved, so it wasn't with my previous midwife, so I had to go through everything again. And because I do go against the mainstream stuff, or well, not really against, I just step away from it. There were quite a few discussions about, yeah, but what if this happens, or what if that happens, or what if that happens, such as what if there is meconium in the amniotic fluid? What if you have prematurely ruptured membranes like you did with Lily Rose? What if they're twins? What if baby doesn't turn, etc., etc., etc.? So I had to talk through a lot of those things with them, but I just kept reminding my midwives that I asked them to be at my birth for a reason, that I haven't chosen for an unassisted birth for a reason, because I know that there are risks and I will be vulnerable when I'm laboring, and I cannot carry all of the responsibility and make all of the decisions when I'm meant to be focusing on my body. So I really do need them, and I'm not going to take away responsibility from them or put them in awkward positions, but it did require quite a few conversations, and it did give me a little bit of anxiety, I'm not gonna lie. So, even with my background and this being my third baby, that giving me anxiety, I can only imagine what it's like when it's your first baby and you don't have all of the knowledge. So just keep in mind that if you have a midwife that is not perfectly aligned with your low intervention approach, that this is part of the story. And that's why it's good to vet your practitioner as early as possible. And I've shared before that in the Ina May Gaskin book, that which I have linked in the pregnancy guide, there's a chapter on asking the right questions so that you're on the same page, because can be quite hard, right? To know, what do I ask to know if we're on the same page. But even finalizing your birth plan early on in the first or in the third trimester gives you enough time to get on the same page and to be transparent and talk openly with your midwife to the extent that that's possible, but you need to build some form of trust. And if that trust isn't there, it's not too late to change midwives. it's just really, really important that you stick to your guns when you want something and that you follow your gut, because I know from experience that not following my gut meant that I gave away my power in a moment that I should have followed my intuition and what I knew in advance. I'm certain that I wouldn't have ended up in hospital with Noel if I had done that. So I want to empower you with that right now and remind you that it is your job to keep your peace and protect your pregnancy bubble, but especially your birthing bubble. If there's anybody that is doing or saying something that puts that at risk, fight it. Because right now you can. Later on, when you are birthing, you can't. You won't have the voice to do it. Or, well, some women do, but I think those are women that are already very convinced, they're very strong in what they want and need. So they have probably already had um, previous experiences that weren't great. So, especially if this is your first baby, if you've had dreams or thoughts about certain birthing positions, take that seriously and protect it with your inner mama tiger. And hopefully, you have a partner that will support you in that as well and is on the same page as you. Because even if in that situation, you need to protect your birthing bubble and you can't, hopefully you'll have a partner that can advocate for that, or a good friend or a sister or even a mom. What was really satisfying for me in the third trimester was to finalize all of my postpartum meals. It's ridiculous, but by the time that I'm 35 weeks pregnant, it's the same in this pregnancy as the previous two. I just get so nervous, like baby could come every moment and I haven't finished XYZ. But I suppose that is just all part of it. And, you know, if baby does come early, you have definitely different worries than whether you have your breakfast ready in your freezer. But it was really nice to be able to finalize that. And I did give it a high, high, high priority. So I'm now 37 weeks and I have pretty much everything done. And anything that I can add now will only be helpful. And then, of course, I finished my home birth and postpartum kit. This was this was a lot of work. I really hate doing it so much. I know a lot of women love doing this and checking off their list and collecting things, but I just hate it. But I have filmed a video already for you in which I'm showing you every freaking item I have in my home birth and postpartum kit. And I think you will find it so helpful if this is your first birth, or if you are planning for a home birth, or if you're just freaking curious how this Dutch woman prepares for this. But I'm certain that whatever your plans are for your birth, you're going to find a couple of items in that video that you hadn't thought of or never heard of, and that are going to make a huge difference for both your birth and your postpartum recovery. So I look forward to sharing that video with you. So of course, I also advise my patients to finalize their birth plan early on, because if they run into any kind of issues, then there is enough time to deal with them without feeling rushed. There are a couple of things that you might encounter in the third trimester that I think are really important to research and to look into. I am sharing resources in the pregnancy guide for you to research these topics in particular, but I will also add information to Growing Bump to help you decide on these, because I am very wary of the following: pitocin drips to start or augment labor. Pitocin or oxytocin or syntocinon. These can really cause contractions to be so violent in a way that it is not natural for your body. Your body cannot keep up to produce enough of the hormones to deal with the pain. As a result, it can become so overwhelming what is happening that you are more likely to opt for an epidural, which in turn is going to cause you to be less mobile in birth. There's going to be a lot more monitoring. Often routine antibiotics are given. So as I always say, intervention leads into intervention. So when you start with something like a drip that seems very harmless because it's just supporting your hormones, isn't it? It's not quite, because synthetic oxytocin is very, very different from your own, that you are making yourself. Also, it can make it harder for you to nurse afterwards because you're throwing off your hormone balance. So this is something I highly recommend to research. Also, I have in my clinic and personal experience so much damage from oxytocin. Babies that are wired, moms that are not able to recover properly. So labor drugs is something that we detox a lot for both children, babies, and moms that are not able to fall pregnant following a labor. So there is a time and place for things. So I'm not saying that you should never use it. It was given to me in the final hour before Noel was born, but it didn't even help me. But Noel did have oxytocin damage that I needed to detox, and I don't wish that upon anyone. Then there's the group B strep test, and this is also something that I don't recommend at all, because a lot of women will test positive, and that is completely normal because we're focusing on a normal bacterial balance, right? A microflora in your vagina, and that can include strep B. We all carry bad bacteria with us, so it's a good chance that you will test positive. And then what happens if you test positive? Then that leads you into the next intervention because you're offered antibiotics, and you may not want to do that because antibiotics have their own risk factors. They also kill off all your good bacteria, and if you're able to give birth vaginally, then you want to give the good bacteria to your child to start their immune system with, reduce asthma chances and allergies and skin issues. So if you're going to wipe all of the good bacteria in advance, that is not beneficial to the start of your postpartum recovery, help you fight infections, and it's not a great start for baby either. So I would be exceptionally careful with this test, doing it at all, or what you do with the information following it. On Growing Bump, I share more about this topic because it's a really important one, as well as homeopathic remedies to help you support a healthy, natural flora, whether you are opting out of the test or you've already been given a test result that is positive and you're facing the choice of antibiotics, or you're pressured into using antibiotics. And that goes beyond, of course, Nourishing Traditions way of eating, which will support a healthy gut and vaginal flora balance and probiotic. In the pregnancy guide, I also have a resource for you on the Rhogam shot, which is about when you have your blood type is Rh negative and your baby's is Rh positive, you'll be offered the Rhogam shot. And this is something that you can refuse. And this is something that you may not hear because it's very important, because it's very dangerous, but there is more to it. So I recommend that if this is you, if you've had this being picked up on in your blood test, that you check out that resource before you opt for that shot. And then there are some other things to think about when you're looking at your birth plan, right? If you want to keep it low intervention, you don't have to think about every potential thing that can go wrong. In fact, I don't recommend doing that. I think it's better to face it and make decisions when you are dealing with it. But a couple of things are good to think about in advance. For example, what if you have prematurely ruptured membranes? Are you going to go in for induction, go to the hospital right away? Or are you going to monitor the situation, monitor the chance of you developing an infection? Are we going to check baby's heart? Are you going to check your temperatures? Are you going to not put anything in your vagina and reduce the chance of infections by avoiding that? Well, you already know what I would do. In fact, that's exactly what I did with Lily Rose, and I would do it the same way again. Or what if you have an emergency C-section? What are the options for a gentle sextio? That is a great one to look into. Even if you need to have an emergency C-section or a planned C-section, you can have it done as gently as possible, and there are more and more doctors that are open to that. For example, you can still have delayed cord clamping. I mentioned earlier the turning of the baby. So what if baby doesn't turn by the time that your midwife wants? You're going to check out Growing Bump, of course. Another one to think about is What if labor stalls? What are you going to do? Because you have options, you know. It doesn't mean that you need to go into hospital right away and be put in a bed and somebody doing a fundal expression and augmentation with pitocin. There are other options, and especially spinning babies has some great exercises and positions to help baby move along, because as long as baby's head is engaged and pressing on the cervix properly, then that is going to help advance labor. So you need to have space, you need to have the calm so that you can produce enough oxytocin yourself, and both those exercises and positions and homeopathic remedies can help support the natural flow of your birth without intervening right away, which doesn't always help the birth because they cause a lot of stress, and stress is going to do the opposite of supporting the birth. So while there is a time and place for emergency interventions, look as much as possible in advance at what can I do to support the natural, the physiological process of a birth. For more information on making informed decisions on some of the interventions offered during birth or in the third trimester, do check out the pregnancy guide. And for detailed homeopathic protocols and remedies, check out Growing Pump. What else can you think of for your birth plan? You may want to include that with everything you want to give informed consent. Please explain to me what you think the risks are, what the options are, and what the risks of those options are, and then let me decide. Remember, you can always say no to everything. You may want to think about what to do with the placenta, because normally it's just thrown away, but maybe that's not what you want. There are artists that can make a print with the placenta and it looks like a tree. You can do that. You can make homeopathic remedies out of it. You can make capsules out of it, and you can also bury it in the garden or maybe in a flower pot. So think about that in advance so that it's not thrown away and then you regret it. What about after the baby is born? Do you want delayed cord clamping? I mentioned that earlier. Are you okay with them taking off the vernix, the white stuff, which is protective of the skin? Yeah, no, right? We want to keep that on. But the chances that they will take it off quickly or bathe the baby. What about the golden hour? Do you want to be left alone and no checks if that isn't necessary because baby's doing okay, and protect that first bonding time? What about baby-led breastfeeding? Look at those kind of things, the things that happen after the birth that have nothing to do with diagnosing and disasters, but things that are supportive of your recovery and baby's best start to life. Then, of course, I tell my patients to continue on their tailored homeopathic remedies that I've recommended to them, but also to start on the remedies that I have been on, that I'm sharing on Growing Bump, to support a timely start of the birth and a smooth progression of the birth as much as possible and reduce complications. And I tell them to finalize their fourth trimester plan because there is life after birth. Surprise, surprise. After the, almost 9 months of maybe getting a lot of support from midwives, getting a lot of support from practitioners, or a lot of attention and lots of checks offered, that stops postpartum. And it's just going to be you and baby. And what can you do right now to set yourself up the best way possible for that recovery, for that bonding? Anything you can think of. That could include stocking up your pantry, of course. That would also include making sure you have all the homeopathic remedies to deal with baby discomfort, like colic or reflux. Support your milk supply. Make sure you have the foods in your home that are supportive, supplements, and of course all of the materials for newborn warmth care, which I will share more of in the fourth trimester modules on Growing Bump that will come soon, very soon. For example, one of the things that I think are such a great staple that I will share more on those modules on are reps for baby colic, but also for postpartum contractions that make such a big difference. In fact, I send this to most of my patients when they are about to give birth, because Not a lot of people know about this, and they make such a huge difference for the recovery and the comfort of both mom and baby. So don't forget to grab your low intervention pregnancy guide down below. And if you are interested in my home birth and postpartum kit, click on the thumbnail on your screen right now, or make sure to subscribe and hit the notification bell to hear when it's up live. And in the meantime, see you in the next video. Bye.